Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about whether you can heal from Lyme and co-infections if there are gut issues or gut infections that are coexisting. Someone posted a question on one of my other videos asking if this was feasible, and they specifically clarified that they tested positive for an H. pylori infection in their gut, and they were wondering if they can battery getting low. There we go. If they could heal, quote unquote, heal from Lyme and co-infections without first addressing the H. pylori. It's a really good question. I talk to patients about this all the time. In my experience, if there is if there are underlying digestive issues along with borreliosis and or co-infections, then in my experience it's really important to treat the gut as part of the protocol, and ideally we would be working on the gut health aspect of things kind of right out of the gate, because my rationale there is that where the health of the gut impacts every other facet of our physiology. If our gut's cranky, we can have more inflammation in various parts of our bodies. We're not going to be possibly not absorbing nutrients or herbs or things like that we might be taking to try to get at some of those systemic microbes, and that is going to have an impact on the health and integrity of our mitochondria, which are so important for making all the energy for our cells, helping our tissues to heal, helping us to feel better and recover, for our neurological function, our mental clarity. So all the stuff we're trying to fix when there's Lyme or co-infections, an underlying gut issue can really interfere with or contribute to. So I think it's really important to address that. Now, with that being said, I've had patients who are either just resistant to the idea of treating their gut. They come in saying, I've got my, I know, I've got Lyme and co-infections, and I just want you to treat that. And I don't have time or patience to work on my gut right now. I've had IBS for 20 years. I've been sick with, Lyme or co-infections for 10 years, and that's the big problem. It's not my gut. And I talked to the patient saying, well, for every reason that I just mentioned, it can be, in my opinion, quite important to treat the gut as well. But sometimes they don't want to, and that's fine. That's their prerogative. As I like to say, like, the patient's the boss, and I'm more than happy to work with what they want to focus on primarily. I'll of course gently remind them along the way, saying like, well, like, oh, you're not getting better quite as fast as you were hoping to. Maybe we should work on that gut of yours. But we take it one step at a time with everybody. But I've had patients where either because they're resistant to treating their gut, or they have gut issues that are just very hard to treat because they're either very sensitive to the treatment for that gut issue, or there's lots of intestinal biofilm, so it's a really hard road trying to get at all those microbes. Like, for various reasons, sometimes we're either not able to treat the gut out of the gate, or it's just a little bit of a long project, and those patients can still get better with the symptoms that are due to the Lyme or co-infections can improve while we're still waiting for the gut symptoms to get better. So it's not a hard and fast rule that like you must treat the gut before you go after systemic infections, but there is a synergy with treating both things. So I hope that I hope that answers the question. If anybody has any questions about this topic or anything else, just post in the comment section below, and I'll do my best to answer it with a future video.